Hi, my name is Christina Funches, and my presentation is on Meniere's disease through the lifespan. My thesis statement is how does motor development and auditory development differ throughout the lifespan of people with Meniere disease compared to those without Meniere's disease? So before we get started, let me give you a little bit of background information on Meniere's disease. Meniere's disease is an inner ear disorder that can affect hearing and balance to a varying degree. People who end up being diagnosed with Meniere's disease begins experiencing one symptom and gradually progresses, although they do not have to experience all of the symptoms of Meniere disease. Symptoms include attacks of rotational vertigo, fluctuating or progressive unilateral or bilateral hearing loss, most often in low frequencies, unilateral or bilateral tinnitus, and sensation of fullness or pressure in one or both ears. They also might experience side effects from the symptoms such as increase in migraines, dizziness attacks, jerky eye movement, nausea, and vomiting, to name a few. Meniere's disease is most common in age range of 30 to 59 years old. However, it could happen at any age, but extremely rare before 20 years old. Meniere's disease is idiopathic, meaning that it arises spontaneously, but is believed to be linked to endolymphatic drops, which is an excess of fluid in the inner ear. Causation of this disease is unknown and is different on a case-by-case basis. On the left is an audiogram of someone with normal hearing. On the right is an audiogram of someone with Meniere's disease. Notice how the pitch is low on the chart on the right. Lower frequencies are gradually lost over time with Meniere's disease, eventually leading to hearing loss in one or both ears. Some studies suggest genetic predisposition to Meniere's disease and reported frequency of familial Meniere's disease (FMD) range between 5 to 14% of patients. Inheritance of FMD follows an autosomal dominant pattern with a calculated inheritance value of 60%. A single chromosome region of 12p12.3 was linked to Meniere's disease in 3 families investigated in the Clare et al. Study. Motor and auditory development of people with and without Meniere's disease is the same until the onset of the symptoms for Meniere's disease. In a paper titled Vertigo and Imbalance in Children by Rena et al., there was 2 cases of Meniere's disease diagnosis. One was a 13-year-old female and the other was a 16-year-old female. Both experienced hearing fluctuation in one ear. These episodes can last from 1 minute to a couple of minutes to hours, but rarely last a full day. But for some, there seems to be a lingering effect. They can occur during the day or wake you up out of a deep sleep. So let's take a minute. Imagine that you're laying in bed and you're about halfway asleep and you just start feeling like you're falling even though you're laying down. This is one of the type of imbalances that someone with Meniere's disease experiences. However, because of these exhaustions of the exhaustion that follows one of these Meniere's disease attacks, the person is usually out for circulation for the rest of the day, maybe even longer. Imagine being able to hear someone speak to you 1 minute and not be able to hearing them at all the next second is rather unnerving and distressing. The unpredictable attacks can cause anxiety, and the hearing loss may lead to depression in someone dealing with this disease, since currently there is no known cure for it. although there are treatments and therapies that are provided. Many of the cases of Meniere disease reported have been among women than men patients. Some studies should be conducted to see why there is more occurrence of Meniere disease in women than in men. Other future studies should be conducted to see if there are other motor and auditory development issues that occur in people with Meniere disease besides the known symptoms. The end. Thank you for watching.